Hey everyone, thanks for checking out this video at my YouTube channel. Today I'm going to go over Quervain's Tenosynovitis. What is it and how can you treat it at home? Quervain's Tenosynovitis involves the tendons and the corresponding sheath, the covering that the tendon runs through, of the extensor pollicis brevis muscle right here in tendon, and the abductor pollicis longus. So what that allows your thumb to be able to do is to extend or pull your thumb back, and then to abduct or pull your thumb away from your index finger. And so those two tendons run through these sheaths or guide tubes right here. Think about it like two cables running through a piece of pipe or two pieces of pipe in this area. So typically you're going to present with pain at the base of the thumb. That pain may radiate up the forearm, it may radiate down into the thumb. And one of the tests that you do for that is the Finkelstein test. So the Finkelstein test, you're going to bring your wrist into ulnar deviation like this, and then bring the thumb down. You can even passively kind of put some overpressure and pull the thumb down. If that has a reproduction of pain or symptoms here, then the test will be positive. You may also notice that your thumb catches. You try to bring your thumb back or even going down. It kind of catches and grabs. A lot of times those tendons, as they're passing through those sheaths, can become irritated. That can thicken in there, and that can cause some of the sliding of the tendon to be decreased as it passes through, or as they both pass through those tendon guide tubes. So from a more invasive standpoint, what you can have done is you can have tendon injections where they'll go in and inject steroids directly into those tendons and the sheaths in this area. Sometimes that works. You can also have a tendon release or a sheath release where they go in and kind of cut open the sheath that runs through here. And so that guide tube, they'll kind of put an incision there and open that up, which creates more space for the tendons to go through. You also can take anti-inflammatories, and physicians may prescribe NSAIDs, non-steroidal anti-inflammatory drugs, and you can use things like moist heat, moist cold, cold packs, even paraffin wax that people use their hand, dip those in those paraffin wax machines. Those work really well just for giving some relief and a little bit of comfort at times when it's really hurting. Those aren't fixes or full, going to resolve the issue completely. You're going to have to typically go through some exercises, some activity modification, maybe a splinter brace to fully resolve those issues. So the first thing we're going to go over is going to be a stretch. So what you're going to do with a stretch is you're going to take the wrist, go into ulnar deviation. So you're going to bring your wrist down like this, and then you're going to take your other hand and pull your thumb down. Now that's the same movement that we did when we did that Finkelstein test, right? So when you come down. So you may not be able to bring the thumb down as well. If not, just work on the wrist, even just stretching the wrist down like this. That's fine at first, and then as that becomes more tolerable, then you can bring the thumb down and really stretch this area. You're gonna hold that for around 10 to 30 seconds. Now with that, be sure that you don't just, a little bit of stretch is good, so more must be better. Be careful of that, because if you overstretch that, you over-irritate that, you're not really making any progress. So just slow, sustained stretches in this position works really well. And that's something you're just going to perform just throughout the day. Next, we want to look at some tendon gliding exercises. So what we're going to do with this is you're going to take the wrist in this position, and you're going to go down. So you're going to bring your wrist down, and then you're going to bring the thumb straight down as far as you can, almost like you're trying to take your thumb and touch it at the base of your little finger. So let's do that. So wrist goes down, the thumb goes down, and then what you're going to do is the thumb comes back up, and then the wrist comes back up. Wrist goes down, thumb goes down, thumb goes up, wrist comes up. So that's the first one. That's going to go into a flexion and extension. The next one we're going to do is going to be abduction. So we're going to go into abduction and then back into adduction of the thumb. So again, we're going to take the wrist in that same position. The wrist is going to go down, and then the thumb is going to come out. The thumb is going to come back in, and the wrist comes up. Wrist goes down, thumb comes out, thumb comes in, wrist comes up. You're going to repeat each one of those, maybe 10 to 15 repetitions for a couple of sets several times a day. You don't want to over-aggravate the area again, so be careful doing that for 3 or 4 sets of 20 repetitions. That may over-inflame everything. We're just trying to get everything to slide and glide a little bit better. Now we're going to start loading the tendons. We have to load those tendons, put them under a stress, because that promotes healing, and it also improves work and load capacity of both the tendons and their muscles. So I have this little exercise band. I'll put a link in the description for some of these. We're going to work on going into extension first. So what you're going to do is take that band, put it over the end of your thumb here, use your other hand or thumb to kind of pull it down, and then work on pulling your thumb back up. So I'm pulling my thumb back up. And initially you want to start with your wrist in kind of a neutral position with this. I had that initially down like that. But you want to start in a neutral position and work on bringing your thumb straight back. So my thumb's coming straight back. And repeat that for 2 to 3 sets, around 10 to 12 repetitions. And then we're going to work on abduction. So this one here is you're going to hold the band over to the side. And this is the one, remember, where our thumb's going to come away from our index finger. So we're going to pull our thumb out like this, back and forth, out as far as you can, 2 to 3 sets of 10 to 12 repetitions. Now let's say when you start doing these exercises, it's really painful and you're not really able to do it. That's okay. I want you to just go through an isometric hold. So that one, where we just did that one going out to the side, so I'm contracting, I feel those muscles firing, there's not much thumb movement, not much is really happening, and then I relax. I'm going to try to push against the band a little bit and then relax. And the same way going down in that position, bring my thumb down, I'm going to hold the band here, I'm going to push into the band with my thumb, not really much movement's happening, and then I relax and I push down again and I hold that and then relax. I'm going to hold that maybe for anywhere from 2 to 5 seconds. I'm going to decrease the repetitions with that. So if it's so painful that you can't just sit there and go through what's known as an isotonic exercise, basically joint movement, we're going to go into that isometric, and that's where you're just doing those static holds, and I would decrease my repetitions to maybe only 3 to 5 repetitions, but holding each one of those for maybe 3 to 5 seconds. Typically with this condition with my patients, I like to also incorporate some wrist exercises because again, those tendons do cross the wrist joint. And so what we're going to do first is just wrist extension. I'm going to take a dumbbell initially that's pretty easy to handle. We don't want to have one that's really hard. You have to strain a lot to do it. And so what you're going to do is go into extension. I'm going to bring that dumbbell back, hold that for maybe a count of 2 seconds and come back down. Pull that back up, hold that for around 2 seconds and back down. I'm going to repeat that for 2 to 3 sets of 10 to 12 repetitions. Also with this, make sure that you don't have a dumbbell that's you bouncing up and down. You don't want to bounce this at the bottom or anything like that and go really fast. Think about just going slow and control with this. And also pain is normal. So if you're doing these exercises, whether it's with a dumbbell or the ones with a band for the thumb, it's normal to have an increase in pain during that as long as the pain goes back down at the end. So typically when our tendons are inflamed, we're going through a tendon program, it's going to inflame some, it's going to hurt a little more while you're going through the program, but that pain should go back down once you stop the exercises, usually within about an hour. So I tell my patients, if the pain goes down within about an hour or so, then that's okay. If it doesn't, if it stays throbbing and aching all night long, then we probably did a little too much, we need to back off. The other one's going to be radial deviation. So with this one, you're going to do, I'm going to prop up here so I have a little more room, is you're going to drop down in this position. So my wrist goes in that position, and we're going to come back up as far as you can, and then back down, nice and controlled. Now with this one, it's going to be a little more difficult probably than going into regular wrist extension here. So this radial deviation, really working those muscles and their tendons as they cross the wrist joint. So again, be careful, don't bounce the weight, nice, slow, and control, and repeat that for 2 to 3 sets of 10 to 12 repetitions. One of the things I always like to incorporate is some sort of manual therapy technique or soft tissue technique. So you're going to use one of these scraping tools, muscle scraping tools, gua sha tools. There's all different kinds you can get. A lot of times these, people will use them on their face and things like that for anti-aging purposes. So you're going to take one of these and put a little bit of lotion or emollient on the area that's painful. And I even, a lot of times we'll go all the way up the forearm with this because remember, the muscles for these tendons are back in the forearm. And I'm just going to lightly glide and kind of scrape over the area. Nothing really aggressive. Some people like to be really aggressive with this. Clinicians like to be really aggressive, or some patients like for this to be really aggressive and you have to bruise and all that. And that's fine if you like to do it that way. I typically do not. That's just my preference. And so I like to just kind of go over the whole area. It feels pretty good just to kind of improve the kinesthetic awareness, that sensory awareness of all the tissue. There's also a lot of therapists like to use it for cross fiber friction massage. So if you're going to do it for that purpose, you're going to go side to side across, side to side across the thumb, the tendon area right here. And I might vary the position my wrist is in. I may go down in this position and go across. I may bring my wrist up to neutral and go across. Just kind of vary that. That's just preference. Again, typically I just use it just to kind of go all over the area. And I'm going to spend maybe 3 to 5 minutes doing that once a day. Taping and bracing works really well to immobilize the area. So we're going to use a kinesiology tape. Now I do like rock tape. I've been using tape for 20 years. Kinesiology tape and rock tape is my favorite to use by far. I just feel like it does the best, stays on the best, lasts the longest, and typically my patients have the least amount of issues with the glue or the adhesive that I've found. So I have a slit kind of cut into this piece of tape, and what we're going to do is put the wrist into neutral. Some people like to bring the wrist in a little bit of radial deviation. That's fine, it's just preference. Try to keep that in a little bit of neutral there. I'm going to pull this back, and then I'm going to press this down. You're going to rub the tape. When you rub the tape, that typically activates the glue. So these kinesiology tapes, the glue is respondent to heat and friction. So we're going to kind of put this on. Which, side note with that, if you're wearing a kinesiology tape of some kind, and you're having trouble getting it off, maybe it's irritating your skin, a lot of times we get in a warm bath or shower and try to take it off. But remember that heat activates the glue. So for most of my patients, I'll have them use a wet washcloth and maybe some baby oil. And you kind of mix that together and put that on there. Make sure that water's cool, it's not hot, and it usually pulls right off. So I'm going to put in that position. That way I can still use my wrist, my fingers, my hand all day, just giving a little bit of support to those two tendons that are painful in that area. The other thing that you can do is you can take some of this tape that sticks back to itself, a Quervain or a Coflex, there's all different kinds. And what you're going to do is again, I have that hole cut for my thumb. Now, I typically would not wear this with this tape, although I guess that you could just to give extra support. So I have my thumb through that. And then what I'm going to do is kind of wrap around my wrist with this. And then I'm going to go through my palm. You don't have to be super skilled with this. It's just kind of going around. Don't get this too tight so that it cuts off circulation or compresses nerves. So you just want a nice, comfortable kind of pressure here. And you're going to go around. As far as how much that you're going to put on, that just varies. It's just preference. You see how I have this. They actually make a thumb spica brace or splint, or maybe a therapist can fabricate you a splint, but you can get them pretty cheap. I'll also put a link in the description for a really nice little brace that a lot of people wear. I've actually used that same brace myself. I've suffered with this condition myself, and I wore that brace at nighttime while I slept, and it did really, really well. And then you combine that with your stretches, your tendon gliding, your soft tissue work, and your exercises, and that typically can resolve this issue for you without having any other complications. The last thing that I want to mention is activity modifications. So you want to be careful while this is really inflamed. If you're carrying maybe a pan or a pot or something heavy, make sure that you're not necessarily doing it with the right hand. If it's my right hand that's affected, maybe you're using the left hand more, or you're making sure that you distribute the weight evenly. Just try to do some different things to avoid this position that's going to bring the wrist into this position or stress it coming down like this. Unless you're going through your exercises, those types of things are fine because you're controlling that. You can grade that or make that harder, make that easier for you. But again, just monitoring your activities. You want to avoid repetitive movements. If you're doing something where your thumb's coming across a lot, you might want to avoid that for a little bit or just decrease how much you're doing. A lot of times we're using smart devices, you're on your phone, you're scrolling. I've had a lot of patients over the years, especially more recent, that come in and this is inflamed. They say, I feel like the only thing I'm really doing is a lot of scrolling, with my thumb. So just be mindful of that. Modify your activities for a little bit, go through your program, and then return to normal function. Thanks so much for watching. I hope this video helps you to Quervain's tenosynovitis. Make sure you hit that subscribe button so you can stay up to date on all my content.